Anxiety disorders, types, causes, and symptoms. In today's video, we're diving into anxiety disorders, exploring their types, causes, and symptoms. Everyone experiences anxiety occasionally, but for some, it becomes a frequent and severe issue that disrupts daily life. We'll examine different types of anxiety disorders and provide management and coping techniques. Feeling anxious before an event, like a test, is normal and typically temporary. However, someone with an anxiety disorder experiences regular, severe worry that can be debilitating. This intense anxiety prevents them from doing their normal activities. Anxiety disorders are quite common, affecting around 19.1% of adults in the U.S. Let's start by exploring various types of anxiety disorders. One type is agoraphobia, which is the fear of places where escape might be difficult or help unavailable. People with agoraphobia avoid specific situations, like crowds or public transport, and in severe cases may become housebound. Another type is generalized anxiety disorder, GAD, characterized by constant worrying over everyday things. People with GAD often experience trouble sleeping, irritability, and muscle tension. Obsessive-compulsive disorder, OCD, involves distressing, intrusive thoughts managed through repetitive behaviors. For instance, compulsively washing hands to avoid contamination. If the compulsion isn't performed, anxiety increases. Phobias are another category, including agoraphobia. They range from common, mild fears, like arachnophobia, fear of spiders, to more disruptive ones. Panic disorder involves sudden panic attacks that cause physical symptoms similar to a heart attack. Post-traumatic stress disorder, PTSD, can develop after experiencing trauma, such as an accident or natural disaster. PTSD symptoms can be temporary or persist over long periods. Selective mutism is a rare disorder where a person avoids speaking despite being able to. Separation anxiety is common in children, but also affects adults. It involves intense fear of being separated from close ones. Social anxiety disorder involves a fear of social interactions, with concerns about social humiliation and judgment. Anxiety or panic attacks produce sudden, intense anxiety and physical symptoms like difficulty breathing and chest pain. While some use anxiety attack and panic attack interchangeably, panic attacks can last from 5 to 30 minutes. Experiencing a panic attack is frightening, and people often fear triggering another one, leading them to avoid potential triggers. Symptoms of a panic attack include sweating, shaking, trembling, dizziness, shortness of breath, nausea, and heart palpitations. Despite their intensity, panic attack symptoms aren't life-threatening. What distinguishes a panic attack is the suddenness and intensity of physical sensations. The causes of anxiety are complex and can include the environment, genetics, and health conditions. A person's life experiences, upbringing, and home environment significantly impact anxiety development. Certain parenting styles may increase anxiety disorder risks, as suggested by a 2014 study. Genetics also play a role. People with a family history of anxiety disorders are more likely to develop one. Health problems, like thyroid or heart conditions, can cause anxiety symptoms. Females are more likely than males to develop an anxiety disorder. Effective treatments are available for anxiety disorders, varying based on the specific disorder. Psychotherapy, especially cognitive behavioral therapy, CBT, is a standard anxiety treatment. CBT teaches individuals to approach their anxiety differently. CBT can include exposure therapy for treating phobias, gradually exposing someone to their fear. Medications, such as antidepressants and anti-anxiety drugs, can help reduce severe anxiety symptoms. Beta blockers may be prescribed for panic disorder to manage physical symptoms. Self-care strategies can aid in managing anxiety daily, although they shouldn't replace professional help for severe anxiety. Support groups provide a space to share experiences and connect with others who understand the condition. Relaxation techniques, such as spending time in nature, meditation, and mindfulness, can calm the nervous system and ease anxiety. Engaging in fun activities also helps. Lifestyle changes, like reducing caffeine intake and eating a nutrient-rich diet, can improve anxiety. Regular exercise and focusing on whole foods, such as fruits, vegetables, and fish, can be beneficial. Anxiety is a normal reaction to stress and change, but anxiety disorders significantly disrupt life. There are numerous types of anxiety disorders, including PTSD, OCD, GAD, and phobias. Treatment often involves a combination of therapy and medication. Seek help if anxiety regularly affects your daily life. We hope this video has provided insight into anxiety disorders, their types, causes, and symptoms. Remember, effective treatments and coping strategies are available. If you or someone you know struggles with anxiety, don't hesitate to seek professional help. Thanks for watching and take care.